the drive. Here we go. Okay, so it's Monday morning. It's a little after 7 and I have a pathology exam at 8 o'clock. Going through the material, I'm like, I've got this. It's easy. This is review. I know this stuff. It makes sense. I don't really struggle with anything. So I'm really worried about what might happen. Sometimes feeling overly confident is actually when you don't do well, because I think you underestimate maybe the difficulty. So we'll see how it goes. I think our exam is supposed to be 116 questions, maybe 112, I can't remember, 112, 116 questions. The goal that I always try to have in mind is that med school moves so fast. It is definitely drinking from a fire hose. And so it's unfortunate that, we put so much pressure on ourselves to get good grades while we're learning through our courses. But that's not the ultimate goal. Just keep in mind, everyone fails exams, everyone struggles in med school. Med school is hard. But your grade in a course today does not reflect the kind of physician that you're going to be, or how successful you'll be even through the rest of your medical career or through the rest of your medical education, right? Because everything is related. Everything is related. Let's say I miss all of the necrosis questions on today's exam. That's going to suck for my grade today, but I'm going to see necrosis. I have seen necrosis in other courses. It's going to come back. I will have further opportunity to actually learn it. And when I get further in my education, when I get into my rotations, I'll have more and more opportunities to see necrosis again and again and again. And by the end of the day, by the time I get to rotations, by the time I get to residency, I will know necrosis. If I don't know it today, I will know it in the future. And that is what makes you a good physician. You will learn it. It will be there. So today's grade is not the end-all be-all. Course grades are a means of making sure that you are working towards learning and understanding as much as you can to be a great physician in the future. But remember that the end goal is to be a competent and empathetic physician. I have another 3.5 years before I will be a resident physician. Right now, I'm a student physician. I'm a student doctor. That means I'm learning. I have plenty of learning left to do. It is 7:37, so I have 23 minutes to get in there before my exam starts. So I think I made pretty good time here. I think I had a little over an hour left on the time that I could use to take the exam. So I'm a little shaken up because it's cold and snowy outside, and on my way to the car I slipped on some ice, and I didn't just slip, but I fell, like cartoon style, like flipped on my back and planted, and actually like knocked the breath out of me for a little bit. I was able to get up and make it to the car, so we're gonna head home and see how I'm feeling. Basically my whole bum and my legs are completely wet now from falling on that ice, but we're gonna get home because we got stuff to do. So here we go. All right, folks, so it's almost 11:30 and I got home from school. I'm actually feeling okay. I'm kind of worried about how my back will feel tomorrow when I'm probably a little bit more sore, but I'm okay. I changed into some clean, dry pants, which are actually pajama pants, because why not? I'm a directed study student and I'm going to be studying at home for the rest of the day. So I get the luxury of hanging out in pajama pants. Before I take a look at what's coming up in my schedule or what I need to move into studying now that pathology is done, I do want to take just a moment and try to kind of brain dump some of the things that I had flagged on my pathology test and write them down and see if I can maybe look some of those concepts up, because I kind of have this tug of war in my brain that's like, well, you need to move on. There's so much more medical school ahead. You might as well just start jumping into the next course. But then there's a part of me that also says, if I can remember some of the things I struggled with on the exam, it's worth looking them up because clearly they're high yield concepts. They were testable, and why not just take, I don't know, 15, 20 minutes right now, see if I can't familiarize myself with them, because again, everything is foundational and builds upon one another. So I'm definitely going to see these things again. If I can kind of get a grasp on it right now, that'll just help me out in the future. Let's see. So this is one of the reasons that I say I love to put everything into Anki, because basically I have one place where I can go to look up everything, instead of if I left everything in, say, like lecture PowerPoint slides and textbooks and then some flashcards and then some external resources. I wouldn't know where to go to find this information at this point, or I would have to go and search so many different documents or so many different websites to try to look these particular things up. So when I put everything into Anki, that means I literally have this database or a repository of information that I know I should already be responsible for having learned. So it's all in one place. Plus there's a really cool search feature through the browse window. So I'm going to go in here, lines of Zahn. Let's see what I have. Okay. And I think I put this on the exam. I think I put that it was associated with post-mortem clots. That's what I had in my head. Retrograde thrombus. I don't have anything that has those words in it. Let's try direction. No. Holy moly. Retrograde thromb does not come up with anything. Direction. What about first aid? I'm gonna Google this, and Google's also a really good friend. Retrograde thrombosis. Arterial thrombi grow retrograde. Stage of shock. Stage of shock. That's probably not gonna get me what I need. I feel like if I put shock, I'm gonna come up with 15 million. I know there's going to be like a section on here just like on shock, which is what I'm looking for. Shocking. Shock. Stages of shock. Pretty sure I got that wrong. That's fan-frickin-tastic. Look at me go. Something about plasma-derived proteins and pain. I'm pretty sure it's a kinin. Pretty sure, if I were pretty sure, I wouldn't be questioning myself right now. Bradykinin causes vasodilation and increased vascular permeability. Pain. Key mediators of pain and inflammation are bradykinin and prostaglandin E2. So, pretty sure I got that one right. We are going to call that good. I struggled last semester with juggling all of my different courses. So I kind of had this very like tunnel vision where I would say, what class do I have my next exam in, or my next quiz, or some sort of assessment? And that really kind of drove my focus. That meant that I would that comes kind of at the detriment of studying any other class. And we do have multiple classes going on. And so I really want to work on this whole interleaving strategy a little bit more this semester. So what I actually did that has really helped me is I just created a quick little, like a Gantt chart almost, of what my semester looks like. And I just did this in Excel, really rough and dirty. I just created this cute little table that shows me all the courses that I'm taking this semester, when they start and when they end, and the asterisks actually signify when I have an exam in the classes. This kind of gives me an idea of what I should be working on at any given time. For example, today I had my pathology exam, so really I don't need to worry about pathology anymore. But that means I can really focus here on pharmacology, healthcare management, human sexuality, OPP, and HMP, because these are the ones that have colors in them, meaning I'm currently in those courses at this time. I have already gone through all of the healthcare management course, all of the material that we've been given. This course is actually for us, it's completely directed study at my school, meaning we don't actually have any live lectures. We're just given all the material and the learning objectives and told, learn this, here's your exam date, go. So I've already put all the information, at least all the information I think I need, into an Anki deck. I have only 106 cards created for it. It's only a 1 credit course. So, I mean, that seems pretty commensurate with what I think it should be. And I have actually been doing these every day. I don't always study all my Anki cards every day the way that I should, but I have been on top of this one pretty well. Before I do that, I'm actually going to see what my buddy has texted me. LOL, that exam was harder than I expected. Was it similar to the one you had in the master's program? Rock out this healthcare management deck. Quality payment plan. Quality payment program. Average daily census. It is inpatient days divided by the numbers in a reporting period. The goal of tertiary prevention is to reduce complications. Primary prevention is to decrease risk factors. Secondary prevention is to effectively treat and, treat most effectively via early detection. Treat most effectively via early detection. That is secondary prevention. And I'm done. Looky there. All right, next up is my human sexuality course. So this one is also another 1 credit course that is completely directed study for my school. So we were given our learning objectives, a bunch of like handouts, documents to read, and the AAMC, they actually have a series of like videos, informative things. We're gonna watch this. Assessing sexually transmitted infection symptoms. I need some like volume here. There we go. I need some popcorn.
Want to see if you're playing today. Can you tell me a little bit about what brought you in? Well, it's a little uncomfortable, but I noticed there's been some issues with my backside. Well, let's start with the top of the basic backside is your so we're going to have a relationship, but you can't use time to be as regular, but no time to be at that process. You guys no time to practice. So
it was a quick little 6-minute video. So start my deck. While I was studying that, I saw some of my classmates actually say in our group me chat that the pharmacology module is up. As a directed study pathway student, for each course as we move into them, we are given these modules, which are essentially a big, huge document of learning objectives for the course. I get to use these as the drivers of my studying. Essentially, I just need to come up with how to learn these particular objectives. That's what I'll be tested on. How I get there is kind of up to me. Typically, it's recommended that you follow the required textbook, but if you haven't noticed, I don't like textbooks. I don't like reading. I'm just going to peruse this a little bit. I'm going to just like compare some keywords in these learning objectives and pull them from my pharmacology cards from last year, because super great thing doing an SMP and then going into the medical program at the same school. We had the same teachers administering the content. So really, if I learned it last year and it's related to this year's learning objectives, I'm golden. I probably don't have to go any farther than that. I can just pull those cards and say, study this, know it, and I'll be good. Here's something that I have to really work on, is not spending like half a day finding cards that I want. So I made a smoothie, and it's like me and when I make spaghetti. I always make enough for like an entire army. And so I have this. I also have this, which I already drank half of before I came up, and then I topped it off. And I still have like half of a blender full in the fridge now. But it is really yummy. Oh my gosh, it's like almost 2 o'clock now. Where does the time go? I think what I'm going to do now is actually watch an HMP lecture that I have that's pre-recorded. We were supposed to have it live tomorrow, but the lecturer can't make it, so they've given us the recording for last year's lecture. So I'm gonna go ahead and just get that out of the way so I don't have to worry about getting it done tomorrow before the lab. Just gonna pull it up and watch it. I'll be honest, I don't ever use this thing. Ugh, what is happening? Oh man.
Okay, let's get started. So Kelly starts these. So take a look at it.
Can I make this go faster?
If there's anything there that doesn't make sense to you, you can't do it, or it doesn't make sense, or you're not on. Look at, I put it up on Friday.
This afternoon. So when you're looking at the head and neck.
That's it for this one, but keep an eye out for more videos to come.
See this guy?
Look over there. Thank you so much for making it to the end of this video. Please help us to grow by liking, commenting, and subscribing. But above all else, just remember that if this mom can do it, so can you.